Hello, my name is Dr. Ryan Uribe with Upstate Sports and Spine Upper Cervical Chiropractic Center in Rochester, New York. I'm going to do a brief preview today of a new technology we're excited to have access to here called Cone Beam Computed Tomography, or CBCT imaging for short. This is a very unique kind of imaging that allows us to see a patient's neck in 3D. It looks kind of like regular x-rays in a lot of these different viewpoints. I'll show you a couple of those here. This would be kind of a neck x-ray view from the side. It would be somewhat of a traditional looking view from front to back. And this is kind of a unique view. This is a kind of top to bottom, and we're kind of cutting a thin slice here to see the top bone in the neck, the atlas vertebra here in particular. And then lastly, we're going to look here at the kind of star of the show, which is the 3D component of the imaging. The software allows me to take the information and reconstruct this patient's spine in 3D. Once we have this on the screen, we can kind of do what we please with it. We can look at it from here on the left side. We could rotate it to the back and look at it from behind. Obviously, we could look at it from the right side. If we wanted to see down the spinal canal, we could tilt it and kind of look right down this canal view, we call it here. And my point of showing this is just the vast array of options we have of how to visualize all the different components of this patient's spinal column. Ultimately, what we're looking for is whether or not all the different joints of the neck, the different joints between these vertebrae, are actually aligned properly, or are we seeing misalignment, or this term we use called subluxation. And an example of that here is I have a screen grab of a patient. Right here, we're looking at the right side joint between the skull, which is right up in here, the top bone in the neck. We're kind of looking at it at a weird angle, but and here is the joint. And we're looking at this edge, and are they smooth and aligned across that opening? And these are perfect right here. Same patient, opposite side. Now we're looking at the left, and I think we can all see here pretty easily that here's the skull, here's that top bone of the atlas, and that junction is not aligned. Pretty easy to tell that. The atlas is kind of slipped up and off to the left here. Very important to find these out. If we have a good roadmap of where they've gone, we have a roadmap of how to put them back, in essence. If you or any of your loved ones are interested in this kind of specific chiropractic analysis and care, we'd be happy and honored to take you on as a patient here at Upstate Sports and Spine.